Good morning, everyone. My name is Victoria Tomczak, and I am the nurse navigator for the stroke program at Hoag Hospital. And I'm here today to talk to you about the warning signs and symptoms of a stroke. So by the end of this lecture, I hope you'll have a better understanding of what is a stroke exactly. What are the warning signs and symptoms of a stroke? What are the stroke risk factors and stroke prevention measures that we can take? And what treatments are available for strokes? So the first thing I want to talk to you about is, what is a stroke exactly? Well, the stroke is a type of brain injury, but it's not caused by hitting your head or falling down or something, causing an impact to the head. It's caused when a blood vessel inside the brain either becomes blocked or it bursts, and that cuts off the flow of blood and oxygen to the brain, which the brain needs a constant supply of oxygen in order for it to function properly. So when we think about strokes, about 87% of all strokes are caused by a blocked blood vessel. So a blood clot gets up in there, it gets lodged, and it cuts off blood flow to a portion of the brain. The other type of stroke, which is a bleeding stroke, or we call that a hemorrhagic stroke, is much less common, and that occurs in about 13% of the stroke population. So what happens when that supply of blood and oxygen gets cut off? So for every minute that the brain is deprived of oxygen, about 1.9 million neurons, 14 billion synapses, and 7.5 miles of myelinated fibers are lost. And after about 12 minutes from the start of a stroke, a pea-sized piece of brain tissue is dying. So what the picture on the right at the bottom of the screen is showing you is that at the very beginning, when a stroke first starts within a few minutes, there's a very small area of the brain that's impacted permanently, and there's a larger area of tissue that can be saved if we restore the blood flow to the brain. And then as you see over time goes on, the salvageable brain, or the penumbra, becomes less, and the core infarct becomes larger. And at some point those are matched, and then the stroke is complete. So then there's no treatment that we can do for that stroke. So the symptoms that are caused by a stroke, what this slide shows us, is that it depends on the circulation, the area of circulation that's impacted by the blood clot. So I'm going to get into each of those a little bit more in just a minute. So a stroke, we want to think of it as a brain attack. So everybody knows what a heart attack is. That occurs in the heart when there's a blockage of blood flow to an area of the heart. Well, you think of the stroke as the same thing. It's blockage of blood flow to an area of the brain. So there's about 795,000 people who have strokes every year in the United States. Stroke is the number 5 cause of death in the United States, but it's the leading cause of adult disability. So that's a big factor right there, is while people are surviving their strokes more often, we have more people living with disabilities from a stroke. And about every 4 minutes, someone dies from a stroke in the United States. So this picture on the right that shows the United States, and you see that very dark purple area. We refer to that as the stroke belt of the United States, and that's where the highest death rates from stroke are, in that southeastern part of the U.S. So I've marked there on the left side with the little orange arrow that points to Little Orange County. Okay, that's where we are. And we have 9 designated comprehensive stroke centers in just the Orange County area. Now when you look at that stroke belt area, the dark purple in the southeast U.S., in say Louisiana, Alabama, Arkansas, they only have 3 comprehensive level stroke centers in each of those states. So one of the reasons there's higher death rates in that area is there's not as much access to care. They don't have the advanced stroke treatment that in abundance like we have in this area. There's also some other factors that we think may contribute to why there's higher stroke and stroke death rates in that area. Is that many times families and generations of families stay in that area, and we know that genetics and heredity is part of our stroke risks. Also, we look at the dietary things in that region of the country. So not only is it the stroke belt, it might be the butter and gravy belt, because they tend to cook with a lot of, fatty things like butter and gravies, and so their diet might impact their stroke risks, as well as a lot of tobacco use in that region of the country. So, and I'll get to some more of those risk factors here in just a minute. So now I want to talk to you about how to know what are the stroke signs and symptoms. So when we think about a stroke, we want to B fast, okay? So the B stands for balance. Is there a sudden loss of balance? E stands for eyes. Is there a sudden loss of vision in one or both eyes? The face. Is there an uneven smile? A is for arm. Is one arm weaker than the other? S stands for speech. So is there a change in the person's speech? And T always stands for time to call 911. Okay, so I'm going to talk just a little bit more about each of those. So B is for balance. Is there a sudden loss of balance or coordination, or are they trying to walk and they're listing to one side or the other? Maybe they're walking like they had a whole bottle of Jack Daniels to drink, although you knew they didn't have anything to drink. That's a sudden loss of their balance and coordination. And that kind of leads to the area of the brain. So on the little picture on the right, the very bottom part of the brain, that's called the cerebellum, and that part of the brain controls our balance and our coordination. So a stroke in that area could lead to that sudden loss of balance. E is for eyes. Is there a sudden loss of vision or decrease of vision? It could occur in one eye or both eyes. It could just be a partial loss of the vision, maybe half of the vision in one or both eyes. And that kind of stroke occurs in the very back part of the brain. You'll see on the right there, the little turquoise blue section. That a stroke in that area of the brain can lead to vision problems. F is for face. So do they have a droop on one side of their face? Is it numb? If you ask the person to smile, does one side droop down? That kind of stroke is going to occur from right in that middle, the top middle part of the brain. That's where the territory of circulation that controls our facial movements is. A is for arm. So is one arm weak or numb? If you ask them to raise both arms, does one arm drift down? This can also apply to the leg. Not quite as common though as arm weakness or numbness, and that's the same circulation territory, that middle part where you see the purple stripe, the red stripe, and then that green in the top. So that's the area of circulation where a stroke occurs, and it affects the face, arm, and leg. And S is for speech. Now, is their speech slurred? Are they unable to speak at all? Are they very difficult to understand, or it seems like they might be making up words? You can ask a person to repeat a simple sentence, like to have them say, "Today is a sunny day." Did they repeat the sentence correctly? Did they use the right words? Did it sound normal? So if there's changes in speech, it could be in a couple of territories of the brain, the frontal lobe or the temporal lobe. So that's when we look right in the middle of the brain, that little light blue area or the green area there. That could be a stroke in one of those areas affecting the speech. And then T is also time to call 911. If a person you're with or even yourself has any of those symptoms, even if they go away, it's important to get to the hospital right away. So it's always a 911 call for stroke. Stroke is an emergency. So we want to be stroke smart and know what are the 3 R's of stroke. We want to reduce our stroke risk, we want to recognize stroke symptoms, and we want to respond at the very first signs of a stroke. So in the US, every 40 seconds, someone has a stroke. But we know that 80% of strokes are preventable. So we have risk factors things like our age, our heredity, race, we can't really change those risk factors, but there are a lot of risk factors that can be changed. We can treat medical conditions and we can control them to reduce our risk for stroke. So the best way to know what your risk factors are is to talk to your doctor about any stroke risks you may have. So first I'll talk about the risk factors we cannot change, our age. The likelihood of having a stroke nearly doubles every 10 years after the age of 55. So although stroke may seem more common in the elderly, a lot of people under the age of 65 have strokes. They may have a few different risk factors than some that I'm going to talk about in a minute, but still we want to be aware that actually anyone can have a stroke, even children. So being aware of what the signs and symptoms are going to help you identify those stroke symptoms in anyone of any age. A family history of stroke can also raise your risk of having a stroke. So if your parents, grandparents, a sister or brother has had a stroke, especially if that stroke occurred before the age of 65, that could increase your risk for having a stroke. And then race can make a difference. Statistics show that African Americans have a much higher risk of stroke and death from stroke, as well as Hispanics and Latinos having some higher risk factors for stroke. So our gender can affect our risk for stroke. Each year, women have more strokes than men, and stroke kills more women than men every year. So about 55,000 more women than men have a stroke each year. And did you know that twice as many women die from a stroke than die from breast cancer every year? So some of the risk factors that go along with being female and our risk of stroke being higher is pregnancy-related complications, history of preeclampsia or eclampsia, gestational diabetes, oral contraceptive use, especially if that is combined with smoking, and then postmenopausal hormone therapy can also be a risk factor for increased risk of stroke. So 1 in 5 women will have a stroke. So if you're in a group of 5 women, you need to look around and decide who's going to be it, not me. Just kidding. But it is a very serious risk, and knowing that those risks, you should talk to your doctor about any risks you may have. Okay, so having a prior stroke or a transient ischemic attack or even having a heart attack in the past can raise your risk for stroke. So a person who has had a stroke has a much higher risk of having another stroke than a person who has never had a stroke. And transient ischemic attacks, or sometimes called TIA, are very strong predictors of having risks for stroke. And a TIA is a smaller temporary blockage of blood to the brain, and it produces the same stroke symptoms, but they may be a little more mild. And a transient ischemic attack doesn't leave permanent damage to the brain. So that's the difference between a TIA and an actual stroke. And if you've had a prior heart attack, you're at higher risk of having a stroke too, because a heart attack is usually caused by plaque that builds up and causes blockages in the blood vessels to the heart, much like stroke is caused by buildups of plaque that cause blockages of blood flow in the brain. So now let's get to the fun part. What are the stroke risk factors that we can control, things we can treat and improve, and thereby reduce our risk of having a stroke? So high blood pressure is the leading cause of strokes worldwide, not just in the United States, but all over the world. So if we manage our blood pressure, keeping our blood pressure within healthy ranges reduces the strain on your heart. It improves blood flow in the arteries, it protects the kidneys, and that helps keep us healthier longer. So a normal blood pressure, according to the American Heart Association, is 120/80 or less. So what does that mean? So a normal blood pressure, we recommend that you just keep living a healthy lifestyle and check your blood pressure annually. If your blood pressure gets a little elevated, so that's the 120 to 129, but the bottom number still stays below 80, we recommend that you have a healthy lifestyle If you don't, there's some changes you can make, maybe a better diet, a little more exercise, and you should get your blood pressure rechecked in 3 to 6 months. If you have high blood pressure, which is the top number between 130 to 139, and the bottom number being between 80 to 89, you should see your doctor, and they should do health risk assessments on you. They may prescribe medications and have more frequent blood pressure monitoring. And then if your blood pressure is very high, which is anything above 140 on the top number and 90 on the bottom number, that really requires good medical follow-up, probably maybe more than one type of blood pressure medication, and frequent follow-up and blood pressure checks with your doctors. And these are the recommendations of the American Heart Association. So when you're getting your blood pressure checked, the first thing you should do is, for a little, like 30 minutes beforehand, no smoking, don't drink a bunch of caffeine, don't exercise, and try to just relax for a few minutes before you actually check the blood pressure. During the blood pressure check, make sure that the cuff is in the right place, that it's the right size. Sit still, don't move around, and then don't talk during the time your blood pressure is being taken, because that really can cause alterations in the readings. So after your blood pressure check, sometimes we recommend that you check it a couple of times, so wait a minute in between. So check it once, wait 1 minute, and then check it again, and average those 2 blood pressure readings. Now, if one reading is very high and the other one's a lot lower, you may want to check a third one just to confirm, and then talk to your doctor. Write those down in a log and take those numbers with you when you see your doctor. And that gives them a very good idea of what your blood pressure is when you're at home and doing your regular activities versus maybe you get a little nervous when you go to the doctor's office and they check your blood pressure. It may be a little higher. So having the record of what your blood pressure is at home is helpful. Okay, the next risk factor we can control and manage is diabetes. So if you have diabetes, that can more than double your risk factor for having a stroke. So people with diabetes also often have high blood pressure, high cholesterol, have problems with their weight. So this increases your risks for stroke even more. So every 2 minutes, an adult with diabetes in the US is hospitalized for a stroke. So working with your doctor to manage your diabetes very well can reduce your risk of having a stroke. The next risk factor is high cholesterol. So that increases the risk of those blocked arteries and the plaques that build up inside our arteries that can block blood flow. That can lead to a stroke or a heart attack occurring. So our diet, we need to eat foods that improve our heart and our brain health. So lean meats, lots of fruits and vegetables, diets that are high in saturated fats or trans fats, so that's those fried foods and fatty foods, raises our blood cholesterol. Diets that are high in salt or sodium increase our blood pressure, and very high calorie diets, so a lot of sugars and things like that, can lead to obesity. So we want to eat vitamin-rich fruits and vegetables that lower our blood pressure, improve our brain function, and our overall brain health, and the health of our blood vessels. Being physically active. If you're physically inactive, you need to start moving and be more active. Okay, physical inactivity increases your risk of stroke, heart disease, being overweight, developing high blood pressure, higher cholesterol levels, and diabetes. So daily physical activity increases your length and quality of life. So go on brisk walks, take the stairs instead of the elevator, and do what you can to put more activity into your life. And the American Heart Association recommends that we get at least 30 minutes of physical activity at least 5 days a week. So does that mean you have to go out and walk for 30 minutes at a time? No, if you break that up into smaller segments, so if you can do a 10-minute walk in the morning, 10 minutes in the afternoon, and 10 minutes in the evening, that's going to increase that, get you to that 30 minutes of physical activity. And swimming is a good activity. It's low impact and doesn't cause stress to the joints. So I would recommend before you start any exercise program, though, that you talk to your doctor especially if you haven't been exercising at all for some time period. So maintaining a healthy weight. If we're overweight, we need to take steps to get our body mass index into a healthy range, because that excess body weight and obesity are linked to increased risks of high blood pressure, diabetes, heart disease, and stroke. So are you hearing the trend here? Just these healthy lifestyles and healthy things not only prevent us from having strokes, but they can decrease our risk of heart disease and having other health conditions that lead us to being unhealthy. Okay, smoking and tobacco use, and we include smoking, vaping, or smokeless tobacco. Studies have confirmed that cigarette smoking is a crucial risk factor for stroke. The nicotine and carbon monoxide in cigarettes, but it's the nicotine that's in smokeless tobacco and also in vaping products, damages the blood vessels and can pave the way for stroke and heart attacks to occur. So if you smoke, we recommend that you stop. If you need help getting, to quit smoking, there's a lot of resources out there, and Hoag has resources that can help you with tobacco cessation or to stop smoking. Atrial fibrillation is an irregular heartbeat, and sometimes it's referred to as AFib, and it's a heart rhythm that causes the upper part of the heart chambers to quiver rather than to beat in an organized rhythmic manner. And this increases the risk of having a stroke by 5 times. Because that fluttering of the top part of the heart can cause the blood to pool in those chambers of the heart, and when blood isn't moving, it can form a clot. And then the heart has a normal beat, and those clots can get pushed up to the brain. So if you have AFib, you need to know what your other stroke risks are, and you need to work with your doctor to get the right treatment to help lower your risk of having a stroke if you have atrial fibrillation. And then carotid artery disease. So the carotid arteries are the 2 blood vessels that run up in the neck, and they supply blood to the brain. So if the carotid artery is narrowed by fatty deposits or plaque buildups in the artery walls, then even a small blood clot can get stuck in there and cut off blood flow to not only just an area of the brain, but if the blockage is down here, it's going to cut off blood to an entire half of the brain. So keeping your carotid arteries healthy is important. And because they're located so close to the brain, carotid artery blockages can more easily cause a stroke than other artery diseases. So if you have carotid artery disease or even other vascular disease, you should work with your doctor to get treatment to lower your risk of having a stroke. Another really simple way that we can help prevent strokes is by staying hydrated. So drinking enough water every day. So dehydration is linked with inflammation, artery stiffness, blood pressure regulation, and other factors that can raise our risk of heart disease and stroke. So drinking enough water throughout the day is one of the most effective things that we can do to improve our health and well-being. So one of the things that occurs as we get older, our sense of thirst isn't as keen as it is when we're younger. So we may not even notice we're thirsty as we get older. So if you are a little bit older and you're starting to feel thirsty, you're already getting dehydrated. So it's good and important to drink plenty of water throughout the day so that you can prevent that dehydration. But you don't want to try and get all your water in at the end of the day, because then you're just going to be up going to the restroom all night and you're not going to get good sleep. So try and drink that water throughout the day. And then if you drink alcohol, you need to do so in moderation. So the U.S. dietary guidelines say that people should limit their alcohol-related risks by drinking in moderation, which means up to 1 serving of alcohol per day for women and up to 2 servings per day for men. And a serving would be counted as 1 bottle of beer, 1 5-ounce glass of wine, or 1.5 ounces of liquor. So again, do so in moderation. And then restorative sleep helps keep us healthy. A good night's sleep benefits your whole body, including your heart, your brain. It improves our mood, it helps our memory and our reasoning. When we're sleeping at night, that's when the cleanup crew kind of goes through our brain and cleans up all the byproducts of our brain function throughout the day. So if we don't get enough sleep or good rest, our brain doesn't get cleaned up very well at night. So that's why good sleep is important. And then if you have sleep-related breathing issues, so a lot of times we'll call that sleep apnea. That's where when you're sleeping, there's periods when you snore a lot, and then somebody will stop breathing, and then they snort and then start breathing again. That's a really high risk for stroke. Because what that does is those periods when you're not breathing well during your sleep, even if your blood pressure throughout your body is normal, it raises the blood pressure in the brain. So that can be a risk for stroke. And we say that sleep apnea hurts hearts. So it increases our risk of heart failure, elevated blood pressure, atrial fibrillation, resistant hypertension, type 2 diabetes, and stroke. So that says hashtag snored to death, which actually sounds funny, but it's really not funny. So if you know that you have problems with snoring and breathing problems, or if someone you're with, you say, my gosh, you snore like a freight train, I had to smack you during your sleep to get you to start breathing again. That's an important risk for stroke, and they should see a sleep specialist and get a sleep apnea study done. Okay, so remember, 80% of strokes can be prevented. So we control our risk factors, we treat our health conditions, and we improve our overall risk factors for good health. So keep your stroke risks low with regular checkups and get treatment for any medical conditions if you have them. So one of the things we like to do is a stroke risk scorecard, and I think this was attached to the class today. So if you want to take a look at it, so in the left column, where it's red, so you go through and check those boxes and see what high risks you have. The yellow column is things that are moderate risk for stroke, and then the things in the green column are low risk for stroke. So you can go through those boxes, check them off, and add that up. And if you have high risk factors for stroke, you want to take that to your doctor and talk to them about how do you optimize those risk factors for stroke prevention. Okay, and I talked about TIA a little bit, or transient ischemic stroke. Sometimes it's called a mini stroke, but what a TIA is really a warning stroke. It's a warning sign of a future stroke that's about to happen. So more than a third, or 33% of patients with a TIA will go on to have a full stroke. So symptoms of TIA, again, are the same as a stroke. They resolve within minutes to hours, but it's very important to seek immediate medical attention if you suspect that you or someone you're with is having a TIA. And call 911 even if the symptoms go away, because those symptoms can return very quickly. So you might think, whew, thank God that went away, that scared me. Well, that's the time to get to the emergency room so that we can do a workup and identify where did those symptoms come from. Is it a blood clot? Is there a blockage that we can treat so that we can prevent you from going on and having a full stroke that leads to permanent disability? Okay, so remember, the sooner a stroke victim gets to the hospital, the sooner they get life-saving treatment. Every 4 minutes, someone in the U.S. is dying of a stroke, so call 911 for stroke symptoms and be fast, okay? So what do you do when you've called 911? And then the paramedics are going to arrive. There's some key pieces of information they're going to want to know. They're going to need you to tell them the last time you saw the person normal without symptoms. So say you saw someone last night at 10 o'clock when they went to bed, and then they woke up this morning with symptoms. The last time the person was normal was last night at 10 o'clock. But if you're sitting there having a conversation with someone and they suddenly stop talking, they get a weak arm, their face droops, then that is the time they were last known well. So take take a note of what time it is on the clock, and then when the paramedics get there and tell them this happened exactly at 11:29, and that way they know they can share that information with the physicians at the hospital, so that helps us make treatment decisions, and I'll get to that in just a minute. Give them your cell phone number if you're the person that was with the stroke victim, or a family member who might know their medical history, and then try to get to the hospital as well, because the doctors will have questions and they're going to want to talk to you or a family member and get more information about what occurred in their medical history. So the right care right away can make all the difference. It can save a life, it can save the quality of life. So get 911, call 911, get transported quickly to a stroke certified hospital, and Hoag is a certified stroke center. So you can receive comprehensive stroke care here at Hoag. So what happens on hospital arrival? So we called the paramedics, they bring our loved one to the hospital. Well, we always say time is brain. You know, we're going to rush back, we're going to get some advanced brain imaging, and we're going to take a look for anything that shows us there's a sign of a stroke. So some of this imaging shows us a stroke is there. The pink is the stroke, the green is what's area of the brain that can be saved. And that picture on the right shows us there's a large hemorrhage in the side of the brain, so we need that brain imaging to make treatment decisions. So if it's an ischemic stroke or caused by a blood clot, which again is 87% of strokes, there is a clot busting medicine that we can give called tissue plasminogen activator, or alteplase. And there's also clot removal treatments that we can do, where a device is taken up into the brain and we can remove the clot from a blood vessel in the brain if it's a large clot. If it's a hemorrhage, so like that one picture showed us, this image on the right is a bleed in the brain. So if it's caused by an aneurysm that ruptured, we can coil that or do neurosurgery to clip the aneurysm. An intracerebral hemorrhage, which is inside the brain tissue, we do close observation in the neuro ICU, we control blood pressure, and they may even need neurosurgery for that. So knowing what's in the brain by that advanced imaging helps us make decisions. So when we think about those bleeding strokes or hemorrhagic strokes, 10% of those are the type that the bleeding occurs inside the brain tissue. And then about 3% are from a ruptured aneurysm. So this picture on the left, that's where an aneurysm ruptures and then the blood floods around the outside of the brain. And that's very irritating to the brain and can cause a lot of symptoms. So what we need to do is to treat that leaking or ruptured aneurysm. So there's a few treatments we can do. There's something called a flow diverter device that can be put in to block the blood flow in the aneurysm so it stops bleeding. We can fill it with coils to help it fill it up and it clots off and stops bleeding. Or in some certain cases, we have to do surgery inside the brain and put a little clip around that aneurysm so it stops bleeding around the brain. For ischemic strokes, so the treatment criteria. So I talked about telling the paramedics what time that person was last seen normal. That's because we need to know. We have limited time to give the clot buster medicine. So in order to give the clot buster or the IV alteplase, it has to be within 0 to 4.5 hours of the last time the person was known well. So that's why it's so important to know, was the last time they were normal last night before they went to bed, or did this just happen right in front of your eyes and it was just a few minutes ago? And then if the stroke is between 0 to 24 hours, there's still a chance we may be able to go in with that mechanical clot removal for a large vessel occlusion in the brain. So that's knowing what time and then also having that advanced brain imaging. Helps us make those treatment decisions. So clot busting, IV alteplase will go in and if it can dissolve the blood clot and restore flow to the brain. Our mechanical clot removal, our large vessel occlusion, There's a stent retriever that the doctor will thread a catheter up from the groin up into the brain, and actually it will grab that clot and pull it out. And this is an actual picture of what a clot looks like in this stent retriever device. And so the middle image there shows you that there's not a lot of blood flow to those territories of the brain. And then that picture on the right is after that blood clot was pulled out, it restored blood flow to those two vascular territories. So giving the person a much better chance of a good outcome after stroke. And then another thing we can do for a large vessel occlusion, so a larger blood clot in a larger vessel, is they actually have suction catheters that go up in the brain and pull that clot right out of the blood vessel. And that's actually a picture of a clot. It's kind of gross, I know. But, you know, that really gives the person a good chance of good stroke recovery and good stroke outcomes. So that's why you want to call 911 and get your loved one to the hospital right away. So, stroke is a brain attack. It is often preventable, and it can be treatable if you get to the hospital right away. So you want to reduce your risks, recognize stroke signs and symptoms, and respond immediately by calling 911. So whenever you think stroke, you want to be fast. Okay, any questions? I'm happy to answer any questions. So we'll see if there's anything that came through on the chat. Oh, we do have a few questions. So the question was, what should I do if I think someone is having a stroke? You know, call 911. That's the very best thing that you can do is calling 911. If you get to the person to the hospital and we find out it wasn't a stroke, that's great. But if it is a stroke, you know, that gives the person the best chance of getting stroke treatment and having good outcomes. So I hope that answered your question. And then the next question is, what are some of the after effects of stroke? Well, there are a lot of effects that can happen because of a stroke. People can have permanent weakness on one side of their body. It could lead to difficulty using their arm, difficulty using their leg, maybe unable to walk. People can have problems with their speech. They may not be able to express their speech, so they may know exactly what they want to say, but they can't get the words out. That's a condition called aphasia. They may not be able to understand or comprehend what somebody is saying to them, so that's another type of aphasia called receptive aphasia. They can have problems with memory and cognition. So there is a wide array of symptoms that can occur and lasting effects that can occur from a stroke. But I don't want to say that every person that has a stroke has permanent problems. We know that stroke recovery takes time. So most of the recovery from a stroke is going to take place in the first 3 to 4 months after a stroke. So some people with good rehabilitation, they can continue to make improvements. And I actually like to say that stroke recovery lasts a lifetime because as long as people are working and they're doing their rehab, they're going physical therapy, they're trying to walk, they're using their arm, they're talking, that's going to help them get better from that stroke over their lifetime. So, stroke recovery never ends. So was there any other questions? Okay, well, it was my pleasure to be here and talk to you today and to introduce you to the warning signs and symptoms of a stroke. And I'm happy to be here, so thank you.